Hello dear students, today we learned few of the spotters of lower limb. The first question is A. Identify the pointed structure. B. Mention its nerve supply. You can see this region is the dorsum of foot, and this is the medial border and this is the lateral border. You can see a muscle belly. The pointed structure is a muscle belly. So that is extensor digitorum brevis. That is the only muscle you get on the dorsum of foot. So that is extensor digitorum brevis. This is arising from the anterior part of the dorsal surface of calcaneum, and it divides into 4 tendons. The medialmost tendon forms an independent one and gets inserted into the proximal phalanx of the big toe, whereas the lateral 3 tendons join with the tendons of extensor digitorum longus of the second, third and fourth toes. Now its nerve supply is very important because it is supplied by lateral terminal branch of deep peroneal nerve through pseudoganglion. That is very important. So it is supplied by the lateral terminal branch of deep peroneal nerve through pseudoganglion. So what is the action of the extensor digitorum brevis? Since it is getting inserted via its 4 tendons into the base of the 4 medial toes, the action is the dorsiflexion of the medial foretoes in dorsiflexed angle joint, as in case of takeoff of the foot for walking or running. The second question is, label the diagram A, B, C, D, E showing the cutaneous innervation of the sole of foot. So you can see here, this is the sole of foot and this is the medial half and this is the lateral half. This is the medial border and this is the lateral border, and this is the region of the heel. Now we'll see the answers one by one. A is showing the medial half of the sole and also the medial 3.5 toes. So the plantar surface of the medial 3.5 toes and the medial half of the sole is shown by letter A. So that is medial plantar nerve. The cutaneous innervation of this region is medial plantar nerve. B is representing a small segment of the medial border of the sole, and that is innervated by the saphenous nerve. C is the region of the heel. The heel is innervated by the medial calcanean nerve, or you can say calcanean nerve, which is a branch of the tibial nerve. D is the region that is the lateral half of the sole as well as the plantar surface of the lateral 1.5 toes. So this region is innervated by the lateral plantar nerve. E is representing a small segment of the lateral half or lateral border of the sole, including the small part of the heel, and that is innervated by the sural nerve. So you should learn to draw this diagram and also label all the 5 nerves accordingly. The third question is, identify the pointer structure marked with yellow arrow, and B, write one peculiarity and one action. So let us identify the region. The region given is back of the knee joint. So this is the femur and the femoral condyles. This is the tibia, this is the fibula. This is the lateral femoral condyle and this is the medial femoral condyle. And this is the posterior surface. You are seeing the posterior aspect. The pointer structure is the popliteus muscle. So where is the origin of popliteus muscle? It is arising from the anterior part of the popliteal groove, which is present on the lateral surface of the lateral condyle of femur, and it is getting inserted into the posterior surface of the tibia just above the soleal line. There is a line here known as the soleal line. Just above that, of the posterior surface of tibia, it is getting inserted. Now what is its peculiarity? You can see here the origin is tendinous and the insertion is fleshy. So the tendinous origin and fleshy insertion, and also the tendon is within the capsule. So the tendon is intracapsular, or you can say the origin is intracapsular. So these are some of the peculiarities, and this intracapsular tendon is seen between the fibula collateral ligament and the lateral meniscus. Now what is the action of the popliteus muscle? Main action is it helps in unlocking a locked knee joint. What do you mean by locking of knee joint? In simple terms, the locking means full extension. When you're standing on your foot, when your knee is fully extended, that is known as a locked knee. And when you start to flex or when you start walking, there will be slight flexion of the knee joint. So the beginning of the flexion is referred to as the unlocking. So the unlocking of the locked knee joint is done by the popliteus muscle. So because of that, it is referred to as the key to the knee joint. So since it unlocks the locked knee, it is known as the key to the knee joint. It also helps in flexion of the knee joint, and also since it is present between the lateral meniscus and the fibula collateral ligament, it protects the lateral meniscus from injury. Another important question that is usually asked along with this part is the events occurring at the distal margin of popliteus. So at the distal margin of the popliteus, 4 events occur. The first one is the popliteal artery terminates into anterior tibial artery and the posterior tibial artery. Then the popliteal vein is formed at the distal margin of popliteus by the union of the anterior and posterior tibial veins. And the tibial nerve enters into the posterior compartment of the leg at the distal margin of popliteus. And also the nerve to popliteus winds around this distal margin and it enters into the anterior surface of the muscle. Now what is the nerve supply of the popliteus? So it is supplied by the nerve to popliteus, which is a branch from the tibial nerve in the popliteal fossa. And we have already seen that the nerve to popliteus winds around the distal margin of popliteus and reaches the anterior aspect of the popliteus. So the supply is from the anterior aspect, through the anterior aspect of the popliteus. Now this nerve to popliteus not only supplies the popliteus muscle, but it also supplies many other structures. So it gives few tweaks to the tibialis posterior muscle. It also gives articular branches to the superior and inferior tibiofibular joints, and it also supplies the interosseous membrane of the leg. The fourth question is identify the pointed structure pointed with blue arrow. Name any 2 structures accompanying it, specifying the region. So you can see this is the medial aspect of the leg and the foot, and you are seeing the blue colored structure. Okay, so this structure is the great saphenous vein, that is the longest vein of the body, and that is representing the preaxial vein of the lower limb. Now how it is formed? It is formed as a continuation of the dorsal venous arch, which joins with the medial marginal vein, or you can say joins with the dorsodigital vein of the medial side of big toe, and then it courses upwards and terminates in the femoral vein. So I'm not going into the detail of great saphenous vein. We'll discuss that later. So this pointed structure is the great saphenous vein. Now what are the structures accompanying it? Basically there are 3 structures accompanying it. In the thigh, you have got few branches of the medial femoral cutaneous nerve, or you can say the medial cutaneous nerve of thigh. In the knee, you have the saphenous branch of descending genicular artery accompanying the great saphenous vein. And at the region of the leg and foot, the saphenous nerve is accompanying the great saphenous vein. So any 2 you can write along with this question. We'll see the last question for the day. Identify the pointed structure marked with yellow arrow. Write its arterial supply and embryological importance. So first we'll identify the region. So you can see the gluteal region here and the back of thigh. So the structure is a thick nerve. So the thickest nerve in the body is the sciatic nerve. So answer is the sciatic nerve. Now what is the root value of sciatic nerve? It is the largest branch of the sacral plexus, and the root value is L4, L5, S1, S2, S3. Now what is the arterial supply? It is accompanied by a special artery known as companion artery of sciatic nerve, and its name is arteria nervi ischiadica. This arteria nervi ischiadica is a branch of the inferior gluteal artery. This inferior gluteal artery is a remnant of the axis artery of lower limb. The embryological importance is that it is an example of the axis artery of lower limb. Now during surgeries like amputation above the knee, you have to take care of this artery. You should be aware of this artery and you should ligate it properly to avoid profuse bleeding during the surgery. Now how does the sciatic nerve terminate? It terminates at the upper angle of popliteal fossa into 2 branches, that is the tibial nerve and the common peroneal nerve. The smaller terminal branch is common peroneal nerve and the larger one is the tibial nerve. We'll learn in detail about sciatic nerve later. I hope these topics are clear for you. We'll come up with further questions in the coming days. Thank you.